For the latest, we're joined by Dr Ridhwaan Suliman, Senior Researcher from the CSIR. Doctor, great to have you with us as always. And you often bring us these wonderful graphs which give us a sense of where we are in terms of the third wave in comparison to the first and second. Let's start with the weekly cases, and it looks like it's pretty much the same as for the previous week.
Good evening, Francis. Yes, nationally we're still reporting a high number of infections over the past week. On average, we've reported 19,000 cases per day, and that number is the same as what we did report in the previous week, so no increase or decrease. So nationally we're starting to see a leveling off of reported cases. This is still mostly driven by what's happening in the most populous province, being Gauteng, and there are some promising signs of possible slowdown of reported cases, or even Gauteng having surpassed a peak during this past week. However, infections are still on the rise in all of the other provinces.
Okay, that would be good news, although, like somebody said, you know, half the people get infected on the way down, even if we've peaked in Gauteng. Let's look at the weekly positivity rate, and you've spoken before how when that gets higher, it means we're missing a lot of cases. How does it compare where we are right now to the previous wave, for example?
So at the moment, the test positivity rate nationally, on average, is just under 30%. So it is incredibly high. Remember that the test positivity rate is a proportion of the number of positive tests in relation to total tests conducted. So over the past week, the number of tests that we've conducted has decreased slightly, down to 65,000 on average per day, and that's down 7% week on week, but we're still reporting a similar number of infections nationally, and so the test positivity rate has risen by 7% week on week. At 30%, or just under 30% currently, it means that 1 in every 3.5 tests conducted is returning a positive result. It is still slightly lower than what we saw at the peak of the second wave, where the test positivity rose to over 33%. However, it still is incredibly high, and it's still of concern.
Sure, it really is. Okay, you were saying perhaps there's some good news in Gauteng, but let's look at Gauteng specifically, still accounting for the vast majority of cases. And I mean, maybe you can comment, Doctor, why has it been so bad in this province?
Yeah, so Gauteng is showing some glimmer of hope and some promising signs that the province may have surpassed its peak of the third wave just this past week. However, infection rates are still incredibly high. The province is reporting an average of 10,500 cases per day on average over the last week. That has decreased by 13% compared to a week ago, but still at 66 new cases per day per 100,000 population in the province. The infection rate is incredibly high, and the risk remains high. I think Gauteng, there are probably a few reasons as to why the province was so severely hit this third wave. We do know that Gauteng, relative to the other 3 big provinces, was probably spared during the second wave, and so it was probably likely lower levels of natural immunity in the population, and so more people susceptible to exposure this time around. We also know that the Delta variant has become dominant during this third wave. It is highly transmissible and been spreading very quickly, particularly in a province like Gauteng, which is very densely populated. Once the infection started to rise, it spread really quickly. Then I think large mobility patterns and just large movement behavior, as well as gatherings after the Easter period, have triggered what we were seeing, and it just caused the large surge that we see in Gauteng.
And like you say, it was spared last time. It was hoped that the ones that were hard hit in the second wave would be spared this time, like the Western Cape. But we're seeing that's the next province now of concern, also shooting the lights out in the wrong way. Let's look at the Western Cape.
Yeah, so the other three big provinces along the coast, Western Cape, Eastern Cape, and KwaZulu-Natal, are about 2 to 4 weeks behind Gauteng's trajectory. The rise in Western Cape is still a concern. Cases have increased by 18% week on week, and the case incidence is now up to 69% of its previous peak. And then there's also the increase in KwaZulu-Natal, up 27% week on week, and so I think that province too, being a very densely populated province, really is a concern and needs to be watched over the next few weeks. Beyond the big provinces, I think the neighboring provinces of Gauteng are also of concern. Northwest is at its highest point in the epidemic. Mpumalanga and Limpopo are heading towards their highest points in the epidemic, and Limpopo really surging right now. So many provinces still of concern right now.
Sure, and is it any relief staying on that graph, looking at the different provinces, that at least one and now Gauteng as well have peaked and are coming down?
Yeah, certainly it is a glimmer of hope. However, it's nothing to celebrate just yet because infection rates are still high. We do know that there's a long way down, and there's no guarantee that it will be a smooth sailing downwards. There's always a risk of further outbreaks or super spreader events that can cause this curve to turn again. And so we do need to remain vigilant and not let our not become complacent because the risk still remains.
All right, so the Northern Cape seemingly doing well there, but like you said, there could be little flare-ups. Let's move to weekly hospitalizations, and we know that the hospital pressure has been incredible in Gauteng. Doctors just crying out. Firstly, what is the national picture?
Yes, indeed. The strain on the hospitals and healthcare system has been really incredible, and even mostly so in the province of Gauteng. Unfortunately, hospitalizations and deaths, as we know, do lag cases and will continue to increase. Nationally, we've seen over 11,500 new hospital admissions last week, an increase of 15% week on week, and it is, as mentioned, likely to still continue increasing for at least 2 weeks even after cases start to decline. There are currently 16,300 patients in hospitals around the country due to COVID-19, with 16% of those in ICU. And more than 50% of those are in the province of Gauteng still, with 8,800 patients in hospitals in Gauteng and over 1,400 of those in ICU. So I think the focus needs to still be on the hospitals and healthcare system. And it will unfortunately continue to increase for at least another couple of weeks still.
Yeah. And the grim part, what are we seeing in terms of deaths?
Sadly, following a surge in infections, unfortunately, the true burden or impact of this wave of infections is now being seen by a rising number of reported deaths. Nationally, there have been 375 deaths reported on average per day across the country, and unfortunately, that figure has increased by 52% week on week. In other words, the number of new deaths being reported is doubling about every 11 to 12 days. So sadly, this is a concern, and the number of deaths being reported is increased across many provinces, notably in Gauteng, but also in the Free State, Limpopo, Northwest, Western Cape, and KwaZulu-Natal.
So how badly in Gauteng? I mean, 52% increase, that's significant. What's the provincial picture in Gauteng?
Unfortunately, Gauteng, following the surge in infections, where we saw infections rise to over 2 times previous peaks, we're now seeing, after an expected lag, that the number of deaths is also surging now too. On average in Gauteng, there have been 152 deaths per day over the past week, and that figure has increased by 39% week on week. So in Gauteng, new deaths are doubling about every 2 weeks, and unfortunately will continue to increase as we're still seeing an increase in hospital admissions.
Finally, Doctor, before we let you go, so This is good news that Gauteng seemingly has peaked and is coming out of the peak of the third wave because it's been driving infections. Concerns in other provinces, though. Do we know where we are as a country in terms of the third wave, when we can say as a country we're over the hump?
So as a country, we're probably leveling off or plateauing at this stage, and probably at a peak right now, largely driven by what's happening in the most populous province, being Gauteng. So as shown in the earlier graph, we're reporting a similar number of cases this week compared to the previous. So I think possibly we're at a peak nationally. However, it is being distorted, though, because the other three big provinces are still on the rise. And so we may see a longer tail off in this third wave nationally.
All right, thank you, as always, for your time. CSI Senior Researcher Dr Ridhwaan Suliman. And let's see what the President says tonight at 8 o'clock around the COVID-19 stats.